I think that that's the biggest message that I want to convey in this episode is that if you lose that significant of weight, like,
That
you know,
quick.
30 to 50 pounds, and it's that quick, if you came off of it and you gained the weight right back, then you lost an opportunity, I think, to learn something about yourself.
Yeah.
And that's what I think a lot of people aren't addressing is, okay, you lost some weight, how did you do it? And really thinking back and taking notes about, you know, possibly keeping a journal, like a fitness journal or possibly even a dietary journal or both. And I think that's a lot of what people aren't talking about on all these weight loss injections.
So my question to you is, so yeah, you in general, 3 years you've been off of it and you still look the same and you look great. Now, most people in general population, would they need to continue to take it, or else they're going to blow up?
Well, in the studies they've done with all three of these, tens of thousands of people taking these medications in the treatment groups, not just the control groups. And they overall report that the majority, I mean like the majority, 95%-ish or more sometimes, of the people that come off of the medications gain the weight back. And that's what I'm talking about. I don't think that the medication has anything bad about changing someone's metabolism. I think the people that take it just didn't take the time to try to learn something about themselves
Yeah.
on how they gained the weight in the first place.
Yeah. And then like I said, like with me, whenever I take it, like I don't crave that junk food that I always want. That cheese, that dairy, I barely like it anymore. And I used to be able to eat like 3 cheeseburgers, no problem, chow it down. I can't even eat a half of a burger now. Like I get so full, like even when we go out to eat, you see I'll order like this because I'm starving. And then I eat like a little bit. It's like I got that tummy tuck thing. I swear to God,
Yeah.
You know what I mean? Like I'm just not hungry. And then that's what I learned about my body. So I'm just scared. Am I going to be hungry once I'm off of it? Am I going to be starving?
Well, and that's where I think the food quality makes a huge difference. And we're going to talk about an actual study they just did not too long ago later on. But one of the biggest things for me, I mean, I've been doing weight loss, especially with diabetics, like I said, for decades. But when this came out, it completely changed the game. I mean, the other medications we had, I mean, I don't know if you remember phentermine, fen-phen, stuff like that, but it would reduce your appetite, but also it would kind of give you the jitters and kind of, supposedly give you energy and jolt you up. And a lot of people didn't like that. What's really cool about these medications is they don't do that.
Yeah.
And I think that's a big misconception that people have is they compare it to the old school, the older generation medications.
Yeah.
And that's just not the case with any of these. I'm sure you can attest, right? You didn't feel jittery, right?
I felt, I never felt sick. I never did anything. Even when I did too much, I didn't feel anything. You know what I mean? So, but there are side effects. I know that if you do overtake it, you could get the runs. You can, what's the other ones? Like your tummy doesn't feel good. You get an upset stomach, right?
Yeah.
Nausea, yeah.
But then the other thing too, probably one of the second highest side effects, and especially not just in research trials, but in real world, because the research trials, they control the diet probably better than the real world is experiencing this. Like when doctors prescribe the medications, they're not having that kind of monitoring that you would see in a research trial as far as their diets go on average. And I think that's a shame, by the way. I think doctors should be focused more on the diet of the patients taking these, again, so they can actually learn something in the process.
Yeah.